So this is the main area of the podiatry clinic. This is where the students get most of the clinical experience. It's a multi-chair clinic. It gets quite busy and exciting in here. We have several staff overlooking the students. We're one of the few universities that has its own clinical facility for training students. It gives us the ability to interweave the theory with the practice. It's actually the academic staff that are in supervising the clinics. This is our mechanical therapies lab, which is actually a commercial lab. It produces orthoses for private practice, and it's also used by the students where they can actually get a physical experience of making some actual devices for patients and actually trialing them in clinic. A lot of universities don't have a lab like this, they just learn the theory, but we think, actually having the physical experience of making some of the devices and linking it to the orthopedic problems really does help in terms of them actually making prescriptions for commercial labs in the future. The commercial labs are run by podiatrists, and if they really love this kind of aspect of the course, they could potentially set up their own commercial lab. In addition to the main clinic space, we have three small consulting rooms which are very useful. One in particular, we do the minor surgery in here. We've got all the injectables in the cupboard here and the antibiotics, etc. We've also got the resuscitation equipment in this room as well. It's a quieter space than the main clinic, which can get quite noisy, so it also makes it quite useful for people, maybe patients who have learning differences, who find the noise of the main clinic a little bit distressing. We can come in here and it's a lot quieter really. We also have graduates who treat patients on this site, and they actually don't need supervision and they can work independently in these areas as well. This is a very useful space that we have for treating patients. We can do group assessments in here where many students work on one patient and we discuss a case. The patients here have signed up to be treated by students, so they understand they're going to be used in educational circumstances, so it's very useful to have this room. We also have some of the larger pieces of diagnostic equipment in here, like the mini C-arm, which is a fluoroscopy unit for doing intra-articular injections. We also have some of the bigger treatment kit, like the shockwave therapy. A lot of it is portable and we can move it into the other clinics, but occasionally we'll do the treatments in here so that a group can watch. It's quite a handy room. We've got a treadmill in here for doing some gait analysis, which has an OptiGate system, and it's very useful for teaching functional anatomy as well, including some of the diagnostic kit which we incorporate into the anatomy teaching. One of the beauties of this course as well is we don't just use all the many models you've probably seen lying around. We also go down and do a 10-week dissection program at the medical school, where the students get a leg between probably 4 or 5 students to dissect, and that is a real privilege that not many people get access to on an undergraduate podiatry program. So at the back of the clinical unit we've got this lecture space, which is really useful. We do get patients in here, we've got couches, so we will again do group teaching sessions in this room. We've got lots of models that you can see lying around that we use for teaching anatomy. I do the anatomy teaching here in the clinic because we've got couches and the students can actually practice and draw on one another and examine each other in the couches. So again, it's linking that theory to practice this very effectively. We've also got great projection facilities, HD projection from the interactive learning environment that we use with the students. So thanks for listening. I'm Paul Fletcher. I'm one of the lecturers. I teach the medicine and the anatomy on the programme. Thanks for having a look around the facilities. If you want to know more, do come to Open Days. I'm always around there. And also you can email me on paul.fletcher@northampton.ac.uk, and I'm more than happy to have people visit the clinic when it's in action and see the students actually doing some physical treatment. That's the best way to find out about podiatry, which is a really exciting and unusual career in health that means that you can actually treat people and make them feel better straight away sometimes.